Thank you for staying with us. This is the Skin Therapy Show. I'm your host, Sarah Teshna, and I'm still here with Emily Gatwiri. Just to remind you that today we are talking about farming facial, and you can ask us all the questions on our social media page. That is Facebook, The Skin Therapy Show, Instagram, and Twitter at The Skin Therapy Show. Emily, I'm sure a lot of people would like to know whether there are side effects of the procedure that we've just seen.
For the non-surgical farming facials, there are no specific contraindications, unless, because you can perform the facials in two ways. You can do complete manual facial or the electrical facial.
Yeah.
So the only time we'd consider any contraindications is when it comes to the electrical bit. But when you're doing the manual farming facial, there are no contraindications.
Okay.
You don't have to worry about anything.
A lot of people experience rashes right after doing a facial. So is it the same case with a farming facial?
You cannot rule out the possibility of one getting rashes, but that is not a contraindication. It's a reaction of the treatment. Sometimes it can be 1 to 2 days, but if it's persistent, then you change the products. But you don't react from the procedure. It may be the product that you use during the procedure.
Okay.
Yeah.
And I just wanted to know whether you go the extra mile just to find out what kind of a skin your client has before you perform a procedure, because I'm sure there's some ingredients in whatever you use that might not go well with other people. Do you go the extra mile just to find out what kind of a skin my client has? Is this facial going to have any side effects on this person?
Definitely we do that. Before any facial procedure, you have to do a skin analysis.
Yeah.
And you have to do a skin consultation with your client, get to know about them, get to know about their previous history, about the skin, what they have used, what didn't work for them, if they are on any medication. Because at times you find out many of the clients who are on medication, when they start on the facials, they tend to get rashes.
Yeah.
It's a reaction from the medication. So you have to sit down with your client, you have to analyze their skin, listen to their concerns before you can perform any treatment. And if you're going to choose the electrical procedure, you also have to find about their medical history as well.
Okay.
Yeah.
All right. So after you performing this procedure, I go home. Do you give me some products to go home with to use on a daily basis before I come for my next facial?
Yes, we do. After every procedure, we call it a home care. We do home care prescription.
Yeah.
We guide you on what to do at home, what you need to do in the morning, in the evening,
Yeah.
once a week. We give you all the guidelines on what to use.
Okay.
Yeah.
And you have said that for you to see a change, you can come in for as many as 6 months for you to start seeing the effects.
Definitely.
As many. Okay.
You first, like for instance, you've walked in, you have a concern with fine lines. Already the skin is damaged.
Yeah.
So you need a series of treatment for you to begin to see the results. Because you need to stimulate the skin to rejuvenate. And at times when the skin is already damaged, you cannot rejuvenate with a wrong interval. It needs to be done on shorter intervals. Then once the results are okay, you can push it to once a month.
Okay.
Yeah.
Is it okay for someone who's suffering from diabetes or hypertension to come for the same procedure?
They can. And that's why I said before you attend to any of your clients, you need to know about their medical history.
Yes.
Because for someone with diabetes, like when you're doing the facials, there are some procedures you might not do for them because of the sensitivity of their skin and even the healing capacity. In case someone gets, like if you're doing the extraction, in case there's an injury in the skin, the healing is so slow.
Yeah.
And for people with high blood pressure also, you need to take care of their status.
Yeah.
So you can still perform the facial, but it depends now with the type of the treatment you're going to choose for them. Yeah.
Have you ever encountered a situation where you have a client, but the procedure is just not working for her?
It does happen when the skin is completely damaged.
Yeah.
By completely damaged, I mean the skin is already sagging.
Yeah.
It has already sagged. You know, there's very little now you can do to lift the skin.
Yeah.
Because the underlying muscles, they are completely damaged. So most likely for people who have gotten a massive damage of their skin, the results are very slow. And even advancement in age. If someone is over 60, they have the sagging skin, there's deep wrinkles, the results will not be as good as someone who is age 40.
Yeah.
Yeah.
And what can people like younger generation do just to prevent the skin from sagging?
First, I would say the biggest thing is the sunblock.
Yes.
I'm a biggest campaigner of the sunblock.
You're campaigning for this one, eh?
Yeah, because I know the damage the sun causes.
Yes.
From 20s, you should have a sunblock. Like every day, seriously use a sunblock. And then it also matters what you wash your face with.
Yes.
Because most of the times you go for these ash chemicals that keeps on stripping your moisture. So you end up to see someone 28, they have fine lines, the skin is looking too dull.
Yeah.
It's because of what they are using. Also
The product they are using.
The product they are using.
Okay.
Lifestyle, people who smoke a lot, do alcohol a lot.
From a younger age.
From a younger age.
Yeah.
It's also not good for their skin. Because smoking is believed to minimize the oxygen levels in the skin.
Emily, it is now that part of the Skin Therapy Show where we get to answer a few questions from social media. I'm sure, and I hope you're going to help me answer this question since you're the expert. Pamela Ondo is asking, I watched your show last Sunday and it was very educative. Can you please refer me to one of the best and trusted skincare? I think this is where you come in.
Okay.
Where are you located and how can people reach out to you?
We are located in Krishna Center, 4th floor. And I work at Dermacare Beauty Clinic. Yeah, we offer facial treatments, facial consultation, and we also recommend facial products that one can use at home.
Okay.
Yeah.
Do you have a website or maybe contact numbers that someone can use, can call?
Okay, you can call us on 0736 566 614. Or you can follow us also on Facebook at Dermacare Makeup and Skincare Clinic.
Okay.
Yes.
All right. Grace Kajois is asking, that was an awesome show. How can I get that sunscreen and for how much? Nikona black spots around the eyes and I'm in Nanyuki. Please help. You've insisted on, the importance. Yes.
Yes. Sunblock will cost around 2,500.
All right.
At SPF 30, which is recommended for our climate. And if she's in Nakuru, Nanyuki, you say Nanyuki?
Nanyuki, yes.
We do courier services. We can send it can be delivered to her.
Okay.
Yeah.
Lastly, we have Wendy Wangeshi asking, I have very deep laugh lines and I wanted to know whether your clinic can treat that or can reduce that. Yeah.
We can treat the rough lines, or we call them expressional lines. But it depends with the age of the client. Because at some part, if you're over 60, it becomes very hard for you to correct the situation. But if you're in your 40s, 50s, you can do anti-wrinkle creams, which helps with rough lines. And then you also do some bit of facial exercise. You can do a facial yoga on your own that helps to tighten the muscles. Because when your facial muscles are tightened, then your rough lines are
How do you do a facial yoga? How do you do that?
Okay, you need to be guided by a professional because you do it for 20 minutes and then it's like 6 times a week. So you need to have the patient, but you need to be guided by a specialist. Yeah, because you need to stimulate your internal muscles. Because you know where your muscle is where your skin is.
Okay.
If your muscles are sagging, your skin will sag. So you can do facial exercise and they really work.
All right.
Yeah.
And unfortunately, we cannot take all the questions, but please do keep the questions coming on our social media pages. That is Facebook, The Skin Therapy Show, Instagram and Twitter at The Skin Therapy Show. And we will get back to you with all the answers. Before we wind up, please just give us your final thoughts on today's topic.
What I'd like to say is that you can look 40 at your 70s. It all depends on the action you do today.
Yes.
If you're willing to have that if you're willing to look young for longer, you need to start taking of your skin now. You need to do the right things. You need to see a professional to guide you.
Yes.
And that's why we are there, to give you advice on what to do. Yeah. And you don't listen to any advice because different skin work differently.
Yeah.
So I'll really emphasize on seeking for professional assistance and doing it now. Like you don't have to wait to be 50 for you to start looking for those services. You need to start now at 40.
All right,
yeah.
Wise words. And of course, do not forget, we at the Skin Therapy Show always insist that you eat a healthy diet, drink a lot of water and exercise. Hey, it's been a pleasure having you, Emily, and we hope to see you again very soon on the Skin Therapy Show. And same to you, our dear viewers. See you again, same time, same place next week. It's good night from me.